this moment to pass the mic over to Amy Coupal, our CEO for the Ontario Caregiver Organization, who's going to be leading this session here today. Over to you, Amy.
Good afternoon, everyone. I am so delighted to be with you today and am looking forward to our conversation. I'd like to get started by acknowledging the Indigenous peoples of the lands that we're on today. Today, there are people joining us from across the province, and I'd like to take a moment to acknowledge the land where I call home and hope that you will do the same. As a settler, I'm grateful for the opportunity to meet here and thank all the generations of people who have taken care of this land. And in particular, the land that I'm on today is of the Anishinaabe, the Haudenosaunee, and the Mississaugas of the Credit First Nation. And as team members at OCO, we're learning about the lands from which we work and exploring how we can be meaningful allies in supporting the recommendations from the Truth and Reconciliation Commission. We're building relationships that are helping to evolve our understanding of the caregiving experience within Indigenous communities. And we do this to reaffirm our commitment and responsibility in improving relationships between nations and to improving our understanding of local Indigenous peoples and their cultures. I want to start our time on this topic today by telling you a little bit about OCO. So we can move to the next slide, please. We are a charity funded by the Ontario Ministry of Health, and we exist to improve the lives of Ontario caregivers. We have a range of programs and services, including our 24/7 helpline, and we gather insights, we engage caregivers in program development and design, and we also work with our system partners, such as OHTs, to integrate caregivers across the healthcare system. And that's why I'm so pleased to be here with you today. So in our quick 30 minutes together, and we'll certainly try and make it worth your while, you'll hear about some insights from this year's Spotlight report and a recent report that we issued on preparedness, looking at caregivers who expect to take on the caregiving role in the next 5 years. We're going to highlight some of the challenges that caregivers are facing in managing their caregiving role, and why they're so critical and what this means to our healthcare system and our work together, as well as exploring specifically what your OHT can do to integrate caregivers and advance your priorities. So let me tell you a little bit about the research and work that we do. Each year, OCO engages caregivers across the province to understand their unique and shared experiences. And once again, our Spotlight report from the end of 2024 reveals the increasing toll that caregiving is having on Ontario caregivers. They are taking on more responsibility. The financial impact continues to be a challenge, and more caregivers are feeling the negative impact on their physical and mental health. This year, we also gathered some insights on how ready Ontarians were to take on the role of caregiving. And there was such rich data that came out of that we decided to release a separate report, which we just did a couple of weeks ago, called Preparing to Care. And I'd like to share some of the highlights from that in our conversation today, and look forward to calling out a couple of really key insights that came from that. But let's start first with our 2024 Spotlight report. We know that there is an estimated 4 million caregivers in the province of Ontario, and we expect, based on the recent preparedness data, for that number to increase to up to 9 million people by 2030. So we see presently that there are caregivers in every age group, and you can see those broken down on your slide. And we also see that the gender split is fairly even around men, women, non-binary, as well as those who prefer not to identify. We know that OHTs are striving to improve transitioning care and developing a more integrated model of care. So I'll share some information on the next slide that will help to highlight that. We know that 84% of caregivers care for one person, often an older family member, perhaps a parent or an in-law. We also know that 51% of caregivers are part of what would be called the sandwich generation, and that's people like myself who have a parent or an in-law that they're caring for, as well as raising children under the age of 18. We understand that 49% of care recipients live with their caregiver, and that's really important to consider when we look at care plans and care pathways for patients and clients across settings and in community. And that 67% of caregivers, and perhaps many of you on this call may be one of them, would be balancing work and care and doing that balance of their caregiving responsibilities and being a working caregiver. I also want to acknowledge that there are probably some of you who would fall into that category of double duty caregiver, where you're working within the healthcare system and also then when your workday ends, playing that role of caregiver. So let's dive a little bit more deeply into this because some of the numbers really are alarming. We know that 79% of caregivers feel so tired that it's difficult for them to get their responsibilities done, and that 72% feel so burnt out that they're unsure of how to continue, and yet they feel like they have no choice to keep going. And we watch that number rise around burnout every year. So that is a particularly important one to pay attention to, and one that at our organization we're very concerned about, because of course if caregivers reach burnout, not only is there a risk that they will become a patient themselves, but also there's a risk to the person that they care for. 75% of caregivers are concerned that they won't be able to handle their caregiving duties going forward. This to me is a real clarion call when we look at the 4 million caregivers who are doing that caregiving role today, but also when we expect millions more caregivers to be taking on this role in the next 5 years. I'll share some of the specifics on those numbers in a coming slide, but let's go to the next slide for now. You can see that caregiving responsibilities continue to increase significantly each year as they did from last year to this, and we see significant jumps in emotional, cognitive, and mental health supports being offered to their care recipients since last year. And this is largely attributed to growing needs of the person that a caregiver is caring for. So the requirements of the caregiver are going up. We know that most caregivers are supporting someone who is aging. Caregiving can certainly happen across the age spectrum, not only in terms of who the caregiver is, but who they're caring for. We talked about that in our stats a couple of slides ago, because certainly we see needs for children, young adults, and folks in midlife who need caregivers as well. And in fact, if we look to our colleagues at the Ontario Hospital Association, they've highlighted an increased prevalence of chronic illness and disease in younger populations, which is an important one for us to pay attention to as well. But in the state of caregiving today, we know that most caregivers are supporting someone who has aging-related ailments around frailty, Alzheimer's, mobility as the top 3 conditions that a care recipient might be receiving care for. And so as you plan for the care of frail adults or palliative care pathways or chronic health conditions, we encourage you to consider the role of caregivers in providing support and care within your OHT community, and particularly around aging population facing mobility issues and Alzheimer's disease. So let's look at this from another angle. Caregiver distress, which I know many of you are focused on and in dialogue about, really is an important piece for us to talk about because caregivers are not coping well. You can see from the chart that 3/4 of caregivers are experiencing significant burnout. We touched on this already, and that they're really at the breaking point in terms of that role. We know that caregivers are most worried about their care recipients' declining health and making sure that their needs are met, but also balancing their caregiving responsibilities with other responsibilities such as family. So this is so important in terms of OHT planning. Highlighting and being aware of caregiver distress in your planning, because we know that evidence shows that when caregivers aren't doing well, patients or clients aren't either. And so that caregivers become a risk, not only around becoming a patient themselves, but around whether or not they'll have the capacity to continue to provide care. We hear the same top priorities from caregivers year over year: respite, mental health, one-to-one support are things that caregivers tell us time and again that they need, as well as financial. So perhaps we'll go to that next. because we know, if we go to the next slide, that caregivers are feeling the financial pressure and that they are particularly at risk in that regard. The average caregiver is spending $641 a month related to support for their care recipient. So this may be due to out-of-pocket expenses related to their medical care. It may also be around their cost of living, and so that's a fairly significant amount. And so we hear from caregivers that about a third of them are really feeling this financial toll. And so in most cases, caregivers are using their personal finances or savings to cover the cost. 1 in 4 have taken out a loan or are using a line of credit. And I want to balance this with some of the insights that we found from the preparedness report. Caregivers, or rather prospective caregivers, told us that they are not prepared to take on this role of caregiver, that they haven't considered or planned for the financial impact of caregiving, and that a very significant portion of prospective caregivers are not prepared to take on the caregiving role at all. And one of their key reasons is because they don't feel that they have the financial capacity to do so. We'll dive a little more deeply into that shortly. But for now, let's talk about balancing work and care, which I also highlighted earlier. We know that working caregivers are often making sacrifices at their job to manage their caregiving responsibilities. They may have to take time off, a leave, or even leave their jobs. We know that caregivers are receiving an increased amount of understanding from their colleagues from what we've seen in previous years. So I want to highlight that as a positive, but that they need more understanding and support from their employers. If we look at our preparedness report, it's really interesting to contrast our spotlight data on this with our preparedness data, because 36% of caregivers say they were not prepared for the impact that caregiving would have on their ability to work. That's folks today. But 64% expect that they would have had more support from their employers. And prospective caregivers expect this. So one of the things that we'll be doing in talking with employers as we move forward is really considering this factor. 67% of caregivers are employed. So that's well over half of caregivers in the province fall into that working caregiver category. And so that means for our workforce across our communities, all the folks that you may be engaging with through your OHT may be impacted in their roles. And as I mentioned earlier, we also have these double duty caregivers, meaning that they're caring in their professions and they're caregivers at home. So this, I think, adds a whole other nuance and layer that we could be talking about within our communities. So let's talk about this in the context of where we're going. We know that over the next 20 years, Ontario's population is expected to grow by 36%, and that the most significant increase in age cohort will be those who are 65 and older. Layer that in parallel with the millions more Ontarians who are projected to be living with chronic illness. And this is not just older adults, but also younger individuals as well. We know, and this is widely accepted by our system partners, that our province is poised to face unprecedented demand for healthcare, including primary, home, community, hospital, long-term care, social services, etc. And that this surge is really going to place extraordinary pressure on family caregivers. It's one of the reasons that we wanted to look at this preparedness piece and what caregivers would need and how we have this dialogue with system partners. So let's look at that a little bit more. In the previous slide, we spoke to the fact that there could be up to 9 million caregivers in the province of Ontario as early as 2029, 2030. But when we look at our preparedness report, we have up to 27 million Ontarians who say they expect to face caregiving demands, but they are not prepared to do it because they are not going to do it for practical reasons, financial reasons, or because they expect that the healthcare system will provide all that's required. So that's a very significant portion of prospective caregivers. You have about 2.5 million caregivers who say, I know this is coming based on the relationships with the folks in my life, parents, in-laws, aunts, uncles, neighbors, etc. And I am thinking that this is coming for me. Then you've got this other 2.7 million people who are saying, I know this is coming and I don't intend to do it for those reasons, practical, financial, or I expect the health system to do it. That alone provides a huge conversation that we need to be having together about how we give people the information they need about how to plan for being a caregiver practically, financially, etc., but that also that we're catching them early. We know that that caregiver identification piece is so important in all of our settings, that caregivers are being identified, included as part of the care team, and connected with the support that they need. And that will be more important than ever with the growing number of caregivers coming online in the next 5 years. So let's keep going. We know we have this aging population combined with that increased chronic health conditions across the age spectrum. And we also know that older adults today, as well as folks who may be considering their plans for older adulthood, have a desire to age in place. So when we overlay that with the risk of caregiver burnout, we really need to think about that in terms of patient risk and the risk of the caregiver becoming a patient, and how we mitigate that by giving people the support that they need at home to age in place well, and that needs to factor in the caregiver. So it's critical that we plan for, but also with caregivers, because thinking about what the lived experience is of caregivers can bring a whole other perspective within your OHTs to what caregivers need. So we want to ensure that they're included in chronic disease pathways, home care models, intake, and also transitions. Transitions is one of those things that caregivers have highlighted as a really key challenge for them, and an area where they'd like to see improvement and support over time. So we know that there is an opportunity for OHTs to action the needs of caregivers across your models of care. And I hope that some of the things that we've highlighted as a part of the conversation today underscore that. And I look forward to a little bit of dialogue before we're completed today around your thoughts or questions on that. We strongly recommend that you identify caregivers as a priority population within your OHT, so that their needs and their roles are layered into all of your pathways and your models of care. And I really want to acknowledge Bianca and the work that she is doing. If you are at our webinar, I hope that that means that you're getting our newsletter and that you're seeing some of the exemplars that are being featured around the success stories within OHTs. And some of those things have come out of work that Bianca's had the opportunity to do with OHT partners. And so we encourage you to look at that and really consider what are the needs of caregivers, the roles of caregivers, and how do we work that into the pathways and the models of care. We also encourage you to ensure that caregiver support is embedded in your models of care and connect caregivers to both local and OCO supports through the Ontario Caregiver Organization. So one of the things I like to talk about within this is if caregivers only get one thing, give them our website at ontariocaregiver.ca. They can get our 24/7 helpline on the website. They can get a live chat during weekdays. They can get all sorts of information. And of course, that includes those recommendations and referrals out to local organizations if caregivers are not yet connected with those supports. So it's really, really important that we have that embedded into your models of care to connect caregivers to both OCO and other local organizations. We also invite you to integrate caregivers into your care teams at the point of care. And we've got information and research on this on our website. You can see some of our research summaries through our essential care partner work on this. And of course, reach out to Bianca because she's putting her email in the chat for you to set up a meeting and talk about this in more depth in terms of how you might be able to build your caregiver strategies into your OHT plans. And I would also encourage you to talk to your colleagues who might have worked with her. I would think that they will have great things to say about some of the collaborations and the things that have come out of that as success stories. So those are some of the highlights of things that we wanted to talk about with you today. I know that was a lot of information in about 20 minutes, but we wanted to make sure that we had some time for dialogue. I have not been keeping up on the questions popping up in the chat, but I really appreciate Bianca responding when she can and also gathering questions for our Q&A portion, which we've thankfully arrived at now with some time to explore. So I'm going to invite Bianca back and let's see if you've got some questions already. And if not, we will invite folks as well to pop your questions in the chat and we'll see what we can get to today.
Thanks, Amy. It was great, and thanks so much. Really appreciate the comments that are coming up in the chat. There's some great comments here around, people talking about aging in place options need to consider the role of the caregiver and how these options work with the care recipient and caregiver. We do have a question about what work can we do from the policy level to better support this group? So maybe we'll start there and I'll continue to see what other comments are in the chat.
Yeah, that's a great question, and it's definitely an area of real interest for OCO. We do work with our partners at Ministry of Health, Ontario Health, and throughout the system to look at the policy lens, which is not just provincial, but also in settings in terms of, for example, hospital policies. So I do think that policies are vital in terms of setting the tone and the direction, and then we also have to pair that with those practice and implementation changes, because we know that people's lived experience is most informed by the interactions that they have with providers across the system. And so I think it's a two-pronged approach of looking at policy, updating policy, and to your point, making sure that caregivers are reflected in policy because they've been included in the development of that policy, but that we pair that with those practice evolutions as well.
Thank you, Amy. I'm also seeing, I actually see a very logistical question, which I'm happy to answer. Somebody's asking, are presentations like this offered locally or in-person sessions? So maybe I'll take this opportunity to just say that we do have regional leads, 4 regional leads across the province who are able to present and meet with caregivers locally, offer sessions for caregivers to local community organizations. So certainly if you reach out to me, I'll put my email in the chat again. I'd be happy to connect you with the right person for your particular community. Also seeing lots of great comments here. So really appreciate everybody popping things in the chat. And I'm seeing here, okay, caregivers often spend time reinventing the wheel when trying to navigate healthcare. Is there a pool of navigators at OCO that caregivers can be paired with? Or is there a more appropriate organization, to reach out to for this? And so again, would encourage folks as a starting place to, I think Amy, you said it earlier, you said if people do nothing else, you can provide the helpline information to caregivers directly, and they can call to be connected to support for the person they're caring for in their community, for themselves and their own well-being, and also be connected to supports and resources available to folks at OCO, that some of the programs and services that we have available. So just wanted to flag that.
Yeah, Bianca, I'll just jump in really quickly about that as well. So our helpline is an information and referral service. So I think one of the points of specificity in the question was, would we open up something like a case file and support a more concerted system navigation effort? We do not have the capacity to do that. So I will just say that plainly so that everyone is clear on what we can and cannot do. That helpline, caregivers can call as many times as they want, but we would not be able to open up a file, Amy Coupal's file, every time she calls and go back to everything that's been included in that. We do have a caregiver support team where folks who come through referral pathways, such as our helpline and others, can provide a more escalated support for caregivers who are in very high distress situations. And so that is a possibility as well, though I would not say that that is is a system navigation service, but it is an escalated support. We also have a couple of other supports that I think are relevant to this question in terms of caregiver well-being. If challenges, whether that's system navigation or anything else, a combination of caregiver issues is leading to a greater need for support for caregivers, we also have things like our coaching, counseling, and crisis counseling available. And things like our coaching program help caregivers to create a plan. So I wanted to just add a couple more of those layers to build on that question, Bianca.
Great. Thanks so much for that, Amy. Really appreciate it. I'm just going to go to another question here from earlier, talking about this presentation focused on caregiver needs. I think you sort of talked a little bit this around policy earlier, Amy, but just asking, is there a similar report that's supporting the needs of additional healthcare providers to really balance this increased demand of caregivers to decrease the needs of caregivers, or what's happening or what we're seeing?
You know, there are so many folks across the system that have issued data on projections. So there was one that was just released a couple of weeks ago from the National Institute on Aging. There are definitely some insights that I think would be relevant for folks. Again, it's a pan-Canadian study, but it does have data based on provincial insights. So I think there's some utility in that. There's the study that was generated, which I referred to earlier, by the Ontario Hospital Association, which was released this fall. I believe their projections go to 2040 or potentially beyond. So I would definitely encourage you to look at some of the information from our system partners that would look at some of those broader health system implications. And, you know, then let's have the conversation about the shared priorities and strategies that might be appropriate in terms of supporting caregivers, the people they care for, but as is underscored in this point, healthcare providers. You know, one of the reasons that we do our essential care partner work through our essential care partner support hub is because we know that when caregivers are identified, included as a part of the care team, and connected with the support that they need, that actually improves outcomes for everybody. Caregivers, the patient or client, and the healthcare provider. So if you're not familiar with that work, it's definitely worth taking a look at that on our website. And Bianca, I know you're monitoring for questions. If you're able to pop that link in the chat, that would be great too.
I'll do that in just a minute. And I think probably we can move on to our last slide. We're just quickly running out of time here. I'll pop a few emails in the chat, or contact information, and the website that link, my goodness, that Amy just suggested in there now for folks to peruse. I know we didn't get to all the questions, but just wanted to please encourage folks to get in touch. Would be happy to have further conversations, get into some of the questions that you have here in the chat if we weren't able to get to them. So I'll pop some stuff in for information there and pass it back over to you, Amy.
Yeah, while you're doing that, I think it's great that you've highlighted another webinar coming up for OHTs on key moments for caregiver support that's coming up in early March on the 5th. A couple of our resources in terms of our I Am a Caregiver toolkit, which is also available in multiple languages and for different caregiver communities, such as Black caregivers and LGBTQ+ caregivers. So please do look at our website at ontariocaregiver.ca and see if you can find any specific resources or information for what you're looking for. And then I know Bianca is including emails so that you can get in touch with us, and please feel free to reach out. I mentioned our quarterly e-bulletin. The link for that is in the bottom right of this slide, as well as our URL and all the ways that you can follow us on social. I want to give a big thank you to Bianca and Fardosa for your amazing work pulling this together, and thank you to everyone for joining us today. I hope you felt it was worth your while, and wishing you a great afternoon.
Joining us, everyone. Take care.